Good evening, parents. Thank you for joining me tonight. I'm Dr. Chris, coming to you live today to give you parents another opportunity to get the information that you're looking for, right? Especially when it comes to your kiddos. If you're joining me on this live call or a recorded call later on, it's because you have questions and you have concerns regarding your child's health. And so you want more answers, and yes, you want more information so that you can put your child in the best possible position to have the best health possible, right? Because we know that if a child is healthy, they are happy. If their health is struggling, they struggle. Their growth and development struggles. And guess what? Your entire family struggles. So tonight, I'm going to give you an in-depth insight into kiddos that we commonly see in our practice and some stories on how we were able to change the trajectory of a child's health to improve for a better future, right? So without the use of surgery, without the use of medications, without the use of putting something in the body or taking something out of the body. And so an all-natural, drug-free approach to improving your child's immune health and immune function and building happier, better lives, right? So for those that are just rolling in, joining us, make sure that on the bottom of your screen, you can click the chat button. It'll pull up the Zoom group chat. And so you can type in where you're from, type in any questions that you have. Dr. Angela's on the other side of this. She's going to be answering those as I go through the webinar. And so what we're going to do today is we're going to cover a hot topic, right? Ear infections. And so this is a big topic that we discuss with parents about their children, especially younger children, right? With the reasons as to why health and immune function is vitally important. So it's very simple when you think about it. A stressed out nervous system has trouble fighting off infections that we commonly get exposed to in our environment. So let me just tell you that today's kids, they are pumped with more toxic chemicals and more drugs than I could have ever imagined compared to when I was a child. And so this process of getting rid of things in our bodies that we are built to fight off has created an even more imbalance in your child's immune health and immune function when we take that outside-in approach, right? So things like medications, like Tylenol, ibuprofen, antibiotics, they are all commonly prescribed by your child's doctors to help them feel better. And sometimes, yeah, they do work, but the majority of times it doesn't, right? So the ear issues, they come back over and over again. And your doctor may be saying, well, since this isn't working, we have to go down another avenue. So ear tubes, right? And so we got to shove these tubes in your child's ears because they're not in the same positions like that of an adult's ear tubes, where an adult's are more slanted towards the body inward and your child's are more horizontal. And so gravity isn't working as easily and as much with your child's eustachian tubes because they're more horizontal. So draining fluids out of the ears is a lot harder, right? So we have to manually open them up and take neurology and take physiology completely out of the equation and leave these tubes open. And then if that doesn't work, because they rarely do, we got to start cutting stuff out, like your child's tonsils or your child's adenoids. So we got to take these out because if these keep getting inflamed, it can cause inflammation in your child's ears again, right? So can you see the logic of how the outside-in approach works to helping get kids to feel better? It's not always the best option. And so surgery, even minor surgery, is very stressful and very difficult for a child to really recover through because they don't understand what's happening and they don't understand what's going on. So they're constantly switching their brain into that sympathetic system, that fight or flight system, because they have to survive all this bad stress and they have to cope with it. So I remember a family in our office not too long ago, their child had to get their tonsils removed. And the child was not under any chiropractic care. It was all medical routes for this child, right? And so nothing was working. So when this child received this procedure, they got this surgery done, the parents really understood what it was like to have their child's nervous system fire on all cylinders on that sympathetic side. And so what did they notice with their whole family was no sleep, no rest, hard time healing, hard time with emotions, very difficult behavior changes were occurring. And on top of that stress, the parents started to see a lot of their symptoms that they worked so hard to get rid of with us start creeping back into their lives, right? And to the point where they felt like they were back at square one in the process of their care. So can you see where this stuff really takes an effect on the entire family dynamic? When a child is struggling, the whole family has to deal with it. And so that was the one thing that did not get across to these parents for this child. And so I'm going to go ahead and start the screen share here with our PowerPoint to get that rolling for you. There we go. Hopefully you guys can see it and it's up and running well. Good. All right, perfect. And so the issue lies in taking care of the problem, right? It's the cause. So versus just simply addressing the symptoms. Just because this is a very common process, it doesn't mean that it is normal. Some articles even go on to say that it is common for your child to have up to 6 to 8 ear infections in any given year. So that sounds like what? A lot of sleepless nights, a lot of crying, a lot of stress, and a very uncomfortable little boy or girl. But in our society today, it's very common. So in today's world, if you have a child between the ages of 0 and 3, chances are they have been exposed to some viral infections and may have received a diagnosis of an ear infection, whether it's been acute or chronic otitis media. If not, some signs that you can tell whether your child may be experiencing an ear infection would be stuff like pulling or tugging at the ears, fussiness, crying, trouble sleeping, maybe a fever, some fluid coming out of the ear, hearing imbalance issues. But these symptoms look like a number of other things too, like the flu, teething, viral infections, right? It's not always a bacteria causing an ear infection process. So your child, they're experiencing these issues, right? So you take them where? You take them to the pediatrician. The pediatrician, they look at the signs. They look in the ears. They see some redness and some swelling possibly. And then bam, you've got your diagnosis of that ear infection. Unless this doctor actually performs a swab of the ear and then runs labs on that swab, there is no way of determining if the infection is viral or if it's bacterial or if it's an infection at all. So let's hit the next button there. So perfect. What we started with there, ear infections, medical interventions, a struggling child, a struggling family. It's common versus normal. And so this was a testimony we have in our office. These parents, they had their son constantly having ear infections, right? Sinus problems, could never recover. They were always melting down. So they started care with us, right? So the initial process was figuring out what was the cause, right? What started this whole process, and then start releasing that stress in their body to get their son feeling better. So let's see here. So finding the cause is finding the solution, right? We typically find that our kiddo patients who suffer from allergies, sinus congestion and infections, ear congestion and infections, and other similar conditions typically have one or more of these problems that I'm listing here. So number 1, poor plumbing and poor drainage. Number 2, an overactive sympathetic, which is your fight or flight system, which is part of the nervous system that lowers your immune health. And number 3, excessive inflammation within the respiratory and or the digestive system. So let's look at the first one here. And this is the most common one that we see in our practice. It's the poor plumbing and the poor drainage. Most people don't realize that there is a small muscle called the tensor veli palatini, short for TVP. It is responsible for milking fluid down the ear canal, so down those eustachian tubes. And it's very similar to the way your esophagus works, where it milks down the foods that you eat into your stomach, right? So it's the function of the smooth muscles that move stuff along. So if this muscle is not doing its job, yes, fluid can accumulate behind the ear, behind that eardrum, which can lead to a possible infection. But the question is, what would cause this muscle not to work? So this muscle, literally, it has attachments to the upper part of your cervical spine, which is your neck, right below your skull and your head, right at that first very crucial area, that C1, which is the first bone in your neck. And it gets its nerve supply from the upper part of your cervical spine as well. So if there is a misalignment or a nerve interference within this complex and crucial area, the muscle isn't going to do its job very well, or it's not going to do its job at all. So how does this happen, right? Think back to the birth process for your child. Do you remember any interventions? Like, was there a C-section, a cesarean? Did they use forceps or vacuum extraction during the delivery? Was the labor process very long, very stressful, or was it super short? We've noticed a pattern with the kids who come into our office who have a long history of ear infections, in that it is some sort of undiagnosed birth trauma that occurred with one or more of these interventions. When that birth trauma, when it goes unrecognized and undiagnosed and left untreated, it can wreak havoc on the body and the nervous system, leading them down this path of chronic ear infections and congestion problems. We call it poor plumbing and poor drainage. So there you go. There's a picture that I have there of a child who's going through a C-section. Can you see the turn of the baby's head? Can you see where the doctor's hands are? Now, remember, C-sections, they save lives, right? But what do they do during the process of getting the baby out? They got to pull the baby out because there's no force in getting this baby out. The doctor has to use force to get. So the research shows that the amount of traction force per pound or in pounds that is used when a doctor pulls on a baby's head is anywhere from 60 to 90 pounds of pull. That's traction force. Traction opens up joints. It stretches and it creates irritation in your nervous system. So exactly number one reason why we see a lot of kids in our office with a history of ear infections and congestion issues and poor plumbing and poor drainage is because of what happened at the very beginning when they were supposed to be born into this life, right? So that's an easy one that is not recognized and it goes undiagnosed, and it's a physical trauma to our babies as soon as they are born. So our next one is an overactive sympathetic nervous system. So your central nervous system, and I have it highlighted here, your brain and your spinal cord, this system is like the air traffic controller of your body. So most people don't realize how closely related this is with your spine, and your spine actually houses this delicate and this intricate system. It protects it, right? Your brain sends signals and receives signals from the rest of your body through your spinal cord and through all of these spinal nerves. So think of it this way. It's a two-way road of information that's coming in up through the body and going out through the body. So if you have a fixated or a misaligned segment within a vertebra within your spine, it can easily create nervous system irritation and nervous system interference. So think of it this way. It creates a traffic jam. And so if you have a traffic jam that is stuck on this sympathetic side, the sympathetic system, you have your foot stuck on what we call the stress pedal. So it's constantly creating this overactive sympathetic system. So it creates a system that fires on stress. It fires on your sympathetics, that fight or flight system. And what does it do when it does that? It slows down the other part of your nervous system, which is your parasympathetic nervous system, that's important for growth, for development, and for healing. So can you see how these ear infections, they can occur over and over in your child without properly releasing the cause of what started it throughout this whole cascade of events that occur? So once we release that stress, allow your body to get out of this phase of overactive, overwhelm, and overstress into that healing, growing side of your body, it plays a huge part in getting them in better immune health and better function. But it also goes back to that first system, right? So we got to get them off that stressed out system to allow that poor plumbing and poor drainage to start activating and start improving, getting bad stuff out so that stuff doesn't stay in, it's releasing and getting out. So the next one we have here, and this is another tip that we've learned through the process of helping kiddos, is excessive inflammation. So usually caused by what? An intolerance or an allergy to foods, toxins, or other environmental factors. In most kids that we see, they don't actually have allergies, but their immune systems they overreact to irritants in their environment because of a poorly integrated nervous system, right? So going back to poor drainage and poor plumbing and overactive sympathetic system, it's a combination of those, and then adding in another stress or another irritant creates that pattern of inflammation process. So drugs, they can artificially decrease swelling and congestion, but they won't do anything to calm an overactive and a stressed out immune system. So they don't get to the root cause of what's creating this problem in the first place. Many times they actually create nasty side effects, right? So antibiotics they're meant to clear everything out. So good and bad, they kill it. Now in our gut, we have good, healthy probiotics that we need to digest food, that we need to absorb certain stuff in our foods that are good for us. So certain vitamins and minerals and things like that. So the question is, if we, antibiotics, if it destroys it, how do we boost it and then improve upon it? And then on top of that, how do we support your child's immune system once we get them out of that sympathetic side, once we improve that plumbing and that drainage side, systems of their body, right? So I have some tips listed here that can really help with if you feel like your child has excessive inflammation. So number one, remove dairy from your diet, right? So that's your cow's milk, your cheeses, your creams, your yogurts. Cow's milk is good for us if we were cows, right? So, think about it. Humans drink human mother's milk, and then we stop. Baby cows drink a mother's cow's milk, and then they stop. So why do humans continue to drink mother cow's milk? We get much more calcium from our fruits and from our veggies, especially those green leafy ones. So research shows that dairy can actually create you to lose calcium. But for those that are like me, and you really like your milks, I love almond and coconut milk, right? And sometimes a little bit of goat cheese. Still, we got to limit those in times of inflammation, stresses response in our body, like our congestion of our nose and our ears. Number two, limit sugar and grains from your diet. So think of it this way. Sugar, it feeds inflammation and congestion processes in our body, just like dairy does. Now, grains break down into sugars in our body, even when they're whole grains, right? So, and then the third one there, fruits. Fruits, they contain natural and healthy sugars, but it's still sugar. So when we are in a state of inflammation, when we're sick and congested and we're draining stuff out, we got to limit our fruits as much as we can, right? Number three, limit and remove processed foods. So what makes up processed foods? Sugar, grains, and dairy. They're loaded up in processed foods and artificial foods. So limit these as much as you can as well. And the last one, start combating inflammation in your body when you begin this process of getting sick and seeing ear infection or ear congestion and sinus congestion. So things like fish oils, vitamin D, probiotics every single day. So a good, healthy gut is it equals out to a good, healthy immune function because it's boosting that process in our body. So the next step, so how do we test your child's nervous system for that poor plumbing and that poor drainage in that overactive sympathetic nervous system? We use neurological scans that test a child's nervous system function, right? So we're able to find neurological tension, which is stress. We're able to test neurological adaptability and efficiency, which is function, and neurological balance, right? So that's the coordination and the control of everything that happens in our body. So can you see exactly what we were able to see when we run these scans on your child? We're able to test the stress, test the function, and then determine the imbalances in that draining in the balance in the autonomic nervous system, which is the parasympathetic and sympathetic side of that. So responses within your child's body. It's pretty advanced and complicated technology, but understanding them is very simple. And that's how we're able to figure out exactly how to help these kiddos, where we remove the stress, we improve the function, and we allow the responses and the control to work naturally. So the next one here I'm going to jump into a couple stories with you. This is our first scan of a child, a 3-year-old with a history of ADHD-like symptoms. Parents were worried about ADHD. They didn't have a specific diagnosis yet, but as we see with doctors who are noticing these symptoms in kiddos, the diagnosis stages keep getting younger and younger, and so the parents were worried about ADHD because doctors mentioned it to them, even though they didn't have the diagnosis. They also had immune challenges, multiple ear infections that were treated with multiple antibiotics each year. So a lot of stress in this child's body. A little bit of history. The mom had a cesarean section, and she actually, for this kiddo and for this kiddo's older sibling. And so this was the second child of this family, but the older sibling had a history of ear infections. They went down the path of ear tubes and adenoid surgery to prevent more ear infections. And they didn't work, right? So the family they were really concerned because the younger sibling had a very similar history from what the older child was going through. And the parents, they didn't want to resort back to surgery for this child. So take a look at that upper cervical stress, right? The dysfunction, the imbalances, major stressor, major neurological dysfunction. Look at where they are now. So on the left is where they were. On the right is where they were a couple months later. So they had a lot better adaptability, better efficiency, and better function just in general. But we still had some stress to deal with. It wasn't as severe. One says 5 degrees off, the other one says 1.9. The child was, so from where they were before, waking up every single week with some ear issues, staying up throughout the night, creating havoc in the family dynamics. The child went from that to they were having better sleep, better immune health. They were happier, and the parents were so much happier. And now they're starting to bring their older child in for care as well. So the next one we have here, this is a 5-year-old with a history of ADHD, ear infections, anger and behavior issues, and multiple health issues that the parents were going through with them. And mom had just a little history of stressful birth, right? A stressful delivery that ended up with induction. And she said that she felt like once she was induced, the baby came super fast, right? So super fast is not typically what you want for your child to be born into, because they need that natural progression and that transition timing. It's all about pressure, relaxation, and then stretching to allow baby to come out. So she said that she felt none of those things, and everything happened very fast. So super fast delivery is actually a physical stress for the baby because they didn't have time to develop for the moment where they were born. They didn't get that natural squeeze to jumpstart their nervous system function. And forceps were also used. So they had some traction forced used on this baby, creating a cervical spinal cord inflammation response, possibly creating this child's body to start their life on that sympathetic dominant side. So when I say sympathetic dominant side, look at the bottom of your screen on that left side. It says sympathetic, right? And so that little white box is their skin. So they're not only are they out of the good healthy range of the green, they're in that yellow and they're past that yellow in that orange range on that sympathetic side. So we look at that scan and we think reserve. How much stress is their body dealing with, and then how much reserve are they using? So it's very low in adaptability, very low in efficiency. So the function's got to be very low, right? So what we did was we took them from being stressed out and anxious, which is what these scans were telling us. So over time, correcting the stress, it led us down the path of less interference and less stress and less overwhelm. So you can see on the right, lot more white colors. White is with the normal range. So we took them from severe stress into normal healthy ranges, normal healthy function. And then at the bottom, we took them from that sympathetic side. We got them closer to the green box. Again, we're not done with this child's care. We got them closer to the green box, closer to that efficiency, and then on that parasympathetic, good, healthy, growing, developing side. So that's awesome. So if you are wondering how your child's nervous system is working, if you have been thinking about your child's ear infections or suspect that there's an underlying reason for your child to constantly have these symptoms, please give our team a call. Contact New Hope Chiropractic. We can help. We've seen the difference we can make in a child's life to take them from that stressed out, poor plumbing, poor drainage controlled system that is stuck on and interferes with their immune health, their sleep, productivity, their ability to be happy, to less overwhelm, better immunity, better health, better growth and development. So that includes improving the systems that control the ears, that control the nose, that controls the throat. So if a balanced system is working efficiently, your responses to stress, your responses to a challenged environment, it doesn't create as much problems, but instead it's actually helping them get out of that sickness stages more often and into those healthy stages that we all want our kids to be in, to thrive in, right? So it's all within locating the cause of all that interference and all that stress, reducing that stress, reducing what's causing that stress, and allowing the body to heal properly, to work appropriately, and to function efficiently. So with that said, we're actually offering parents an opportunity for this next week only, an opportunity to have your child's nervous system checked for these disturbances in those areas that control your immune system, control your nervous system. So those ears, the throat, the nose, like we talked about tonight, this opportunity will help you guys understand what your child is going through, how to help them through it, and then give your child the absolute best chance at life. So this offer is a VIP discount for your first visit with us. We will go through an entire consultation an examination with the scanning technology to test the stress, the function, and the control. And this could be the difference in getting your child help that they need so that they're not struggling for another year with these symptoms, struggling at school, struggling with friends, with sports, with growing and developing, with learning to read and write. If you are tired of that struggle of your child really losing out on life, this is your chance. This is what we do every single day, is helping kids just like yours to be better, feel better, and then to absolutely have better lives. So let me go ahead and get